People with physical diseases like arthritis or heart disease often have problems with depression. People with mental illness like mood disorders or schizophrenia typically have far worse physical health than those without. So our mental and physical health often interacts, yet health services tend to treat each separately, usually in isolation. We don't treat the whole person often enough. Imparts is a pioneering initiative developed by King's Health Partners. It's a partnership between our member organisations. Imparts works by helping to detect and manage mental health problems in patients with physical health problems, as well as identify and manage physical health problems in those with mental health issues across clinical healthcare, research, education and training. By treating the whole person, the overall health outcomes for many of these patients can be improved. Imparts is currently being used at both King's College Hospital and Guy's and St Thomas's NHS Foundation Trusts. Departments include limb reconstruction, rheumatology and neurotrauma at King's, and dermatology, palliative care, kidney transplant review and teenage and young adult cancer at Guy's. At Guy's and St Thomas's, clinicians in the dermatology department are helping to identify patients with mental health problems such as anxiety or depression and offering basic initial treatment or a fast referral to a specialist service.
It involves giving patients an iPad or an electronic device to use during the clinic before they're seen by the doctor or nurse. The information that the patient's entering onto the questionnaire, it's immediately sent into our electronic patient record, so that when we see the patient in the clinic room, we can include in our consultation further questions about psychological distress they might be experiencing. We now have a clinical psychologist working in our service who can offer support to the patients whilst they're in clinic, or if necessary can help refer the patient on to other specialists. The limb reconstruction service at King's sees people who have had serious accidents. Since Imparts has been in place, around 20% of limb reconstruction patients have been identified with depression. Others have had anxiety problems or post-traumatic stress disorder. And on the back of these figures, we gain funding to employ mental health practitioners to make sure people get the help they need. We provide accredited short courses on core mental health skills for physical healthcare workers.
Training's an intrinsic part of the Imparts project. We have an accredited 5-day module which covers the basics of working with patients' psychological needs. And also we offer a variety of bespoke training programmes. So I go out to the medical teams and we design the programmes for the needs of the team and their patients. For example, in dermatology, we've worked around the issues that come up around appearance and confidence.
Patients also have access to a range of self-help materials which are designed to be relevant to their particular conditions.
We noticed there was a real gap there. There's loads of self-help materials for psychological issues generally, but there was almost nothing for psychological issues in the context of physical health problems.
Living with psychosis carries a heavy physical health burden. People with psychosis have high rates of obesity, diabetes, and many smoke. We're now introducing Imparts at the South London and Maudsley NHS Foundation Trust, where mental health clinicians will use Imparts to identify physical healthcare needs.
In the community setting, we really focus on emotional distress and signs of relapse. And sometimes we can just forget that our patients may need help and guidance with things like diet, their activity levels, smoking and control of their blood pressure.
I can see huge clinical potential for Imparts in helping patients own their physical health and so bridge the divide that's grown up between physical and mental health services.
Imparts can also be used for facilitating patient-reported outcome measurement in routine care, or to identify people who are interested in being contacted for future research.
It's going to be a great tool for clinical audit. Imparts will really help with clinical effectiveness and also will provide a great basis for clinical research, including clinical trials.
So many health risk factors are preventable, but you can only do something about them if you know what needs to change. Imparts has helped us develop an integrated approach to patient care.
Looking after the whole person, which is really the way of the future.